whether you have an injury or you're trying to prevent injury, having some type of scraping routine is really helpful for facilitating the recovery of those muscles. Keep in mind that I have done this scraping technique for thousands of patients at this point. So I've learned a few things along the way and I want to share them with you. I'm going to work on the calf. The calf is sometimes a really difficult area to get to, just because it can be hard to get to the deeper portions. Now, what I like to do is that same idea of using the my two hands, and you see how first this muscle is just in a relaxed position, because then I can kind of get to that deeper area, kind of all underneath here, just like this. But then I can get to the more superficial area by bringing my toes up toward me. Oh boy, this does not feel good, but this is necessary. Okay, so then I can kind of get to here. So you can do a minute with the foot in dorsiflexion, and then a minute with the foot relaxed. The other way that I like to get to this calf is that it's a little awkward, but I'll come in this kind of kneeling position, and then again, like I'll hook my hand behind, so in that way then I can get to this whole area. And it just gives me like a slightly different leverage point than when I'm here. So give both a try, see what you think. Now, for the shin and this peroneal area, here's that anterior tib and your extensor digitorum that comes all the way down into the foot. Don't go over the bone, okay? But it's really helpful to get to this shin and this peroneal area. So it's gonna come into the side here. So you notice how I'm still at an angle, just like this. I'm gonna come through, all the way through, just like that. And again, I'm trying to get to that area for a minute. Then I'll flex this, come up in through here, all along the side. Don't go over the bone. You can come just below here. And then make sure too that you come, like, find these bony areas, don't go over them, but then go to the part though that's just below it. Here's where using the little tip can be really helpful, because a lot of times this part of this anterior tib gets really, really tight right at the top here. So if you're having shin splints, if you're having some type of what feels like an ankle impingement in the front here, actually sometimes even when people have, when they're getting like patellar tendonitis, and also sometimes even some IT band issues, this area in through here will be super, super tight. Then what I like to do is I like to do something that's like, that's a little bit more knee specific. So you can come through and get to this patellar tendon. So just below this part of the knee, and then here's where using that little tip is going to be really helpful. What is also helpful too is, like, see how I'm kind of pulling this skin up to make it more taut? I'm using this hand and kind of pulling that up. That's going to be helpful for getting to those deeper areas. And then you can kind of come along this part of that IT band, kind of come underneath here a little bit more, all through there. So using this little edge is what's really helpful for going around where all the bone is and that hard to reach parts of that muscle. Make sure to scrape each muscle group for about 1 to 2 minutes. If it's a little bit of a bigger muscle, then err on the side of 2. You can even go up to 3 minutes or so. But make sure to move all around that muscle. So even if only one part of it hurts, it's really beneficial to make sure you go through that whole muscle. The other thing is that you want to reduce friction. So use lotion, some type of emollient, or if you're in the shower, make sure that, that your legs are nice and soapy. So then that way then the metal can be the thing that's gliding over your leg, and then it's not like you're just breaking blood vessels because your skin's too dry and it can't do what it's supposed to.